CoQ10 is one of the most researched compounds in both mitochondrial healing and heart health. It is also one of the most consistently disappointing supplements people report taking. That gap is not a coincidence, and it's not a supplement quality problem most of the time either. Most people are solving for the wrong variable altogether. The question was never whether or not CoQ10 works. It's whether or not your system actually has what it needs to use it. I'm Dr. Kenny, root cause health detective and an IFM certified functional medicine practitioner. And in this video, we're going to look at the depletion patterns that make mitochondrial support or heart health support fall flat and what has to be in place before anything else you're taking can do its job. Most people approach CoQ10 and other supplements as a simple math problem. You're low, so you add more. This is very much born out of our conventional paradigm. That logic works when the issue is just intake alone. But when something is actively pulling nutrients out of the system faster than you're putting them back into it, adding more onto one side of the equation doesn't close the gap. And in fact, it can cause imbalances and other roadblocks of its own. That's the clinical problem that I run into with patients again and again who've been supplementing consistently for months. CoQ10, magnesium, B vitamins, NAD, their labs look okay, but their energy and their resilience fall flat. They're not necessarily doing anything wrong, they've just been solving for the wrong variable in the wrong order. So sometimes the question that we need to ask instead of adding something simply is, what is also being pulled out, how fast, and why? So let's start with the most documented depletion driver in this category when it comes to CoQ10, because it's often sitting in the medicine cabinet of a significant portion of the population and people watching this. Statins are the most commonly prescribed cholesterol medication. They block an enzyme called HMG-CoA reductase, and that's the enzyme that your liver uses to manufacture cholesterol from the inside out. But what most people aren't told when they're prescribed statins is that same pathway also produces CoQ10. When you block that pathway with something as strong as a medication, you're not just lowering cholesterol alone in isolation. You also lower CoQ10 synthesis at the exact same time. And this is the way many of our enzymes work in the body. It's not just connected to one solo process. So if you're taking a long-term medication, double check to make sure that there's not documented nutrient depletion on the other side of it. CoQ10 and statins are well documented. A recent meta-analysis of randomized controlled trials found a significant reduction in CoQ10 levels across all 4 major statin types that were studied. So practically speaking, if you're on a statin and you're also taking CoQ10 and nothing is still moving in this category, the supplement may not be keeping up with the pace that that medication is actively removing CoQ10's availability. That's the gap I'm talking about, and statins are only one example of it. Because statins aren't the only medications that do this. There is a broader pattern that rarely gets discussed, especially when you start combining variables and additional medications. Metformin is a widely used medication to help manage blood sugar, whether in prediabetes or diabetes, and it's associated with B12 depletion. This happens over time and gradually, oftentimes before symptoms show up of any kind of need for B12. Proton pump inhibitors, they're a common acid-reducing medication that's available over the counter. They are also linked to a chronic depletion of B12, magnesium, zinc, and iron through reduced absorption when you lower your stomach acid. Diuretics or water pills do the same thing for magnesium in the B vitamins, and beta blockers also have a documented relationship with CoQ10. And these are just the most commonly prescribed medications. When you start mixing them, the process involved in creating your own CoQ10 involves other nutrients as well. So it's important to look at your full depletion picture. A comprehensive review from the Tufts USDA Human Nutrition Research Center found that long-term use of prescription medications can produce subclinical nutritional deficiencies. The term subclinical here just means that these deficiencies are not often caught, and they're developing over months to years, often before they show up on any kind of standard labs. And what this means for someone juggling 2, 3, or 4 medications is that each drug may be pulling from a different nutrient pool. No single test is catching the cumulative picture or the effects on the systems. And by the way, if you're one who likes to dive into the research and you'd like to read the studies that I'm pulling from, I've put together a free research summary. It's in the description in the pinned comment below, and I give my 2 cents on the research articles, including the citations themselves. Here's something I want you to sit with for a moment. supplement. If you're on multiple medications and your energy hasn't moved despite reasonable supplementation, or even if you're not supplementing, this isn't often a supplement quality problem. Something is actively outpacing what you're replacing. That distinction matters too, because the solution looks very different depending on which problem you're actually trying to solve. Now, on top of this medication picture, there's a problem that has nothing to do with prescriptions at all, and everything to do with where your food comes from. The mineral content of conventionally grown produce has declined significantly over the last several decades. Soil depletion, the progressive loss of minerals from farmland due to intensive agriculture practices, these have lowered the nutritious baseline for foods, ultimately. Minerals like magnesium are one of the most affected, and B vitamins are produced in part by soil organisms as well. And as soil diversity has declined, so has that B vitamin production capacity. So this matters for CoQ10 specifically because the creation of CoQ10 requires adequate levels of your B vitamins, particularly B2, B3, and B6, as well as minerals like magnesium. So if this dietary floor for these nutrients has dropped, the body's ability to make its own CoQ10 is operating from a reduced baseline already, before a single supplement is taken or skipped or talked about. So many people, even in the United States, are not even starting from zero. They are starting below it oftentimes. And then on top of this depletion conversation, whether the soil or medications that do it externally, there's also the demand side, because some people aren't just losing more than they're replacing, they're also requiring more than average. For example, chronic psychological stress, whether we perceive it or not, increases the metabolic demand for B vitamins, CoQ10, and magnesium. They're consumed so much faster during sustained activation of chronic stress. High-intensity physical training also increases the load on the body, which draws on CoQ10 stores even more. And chronic inflammation does the same. So the system is often running hotter than a standard supplementation plan accounts for. This is what I call the depletion demand gap. It's not just a deficiency in the traditional sense, where there's a blood marker that's low, and then you just replace that nutrient or substance. The distance between what is leaving the system through and the situation for many people, even with all the goodwill trying to supplement, is that that gap continues to widen quietly over months or years before symptoms even show up. And by the time that they do, they're wondering why nothing is working, and they have a supplement stack that's 27 ingredients long. So before we talk about what to do with this, I want to be clear about something, that this isn't an argument about whether or not CoQ10 works. It's an argument that CoQ10 cannot do the work that the upstream conditions are actively preventing. And that distinction is where the clinical question actually starts. Here's where the form and the delivery question become relevant, and where I want to be honest with you about what the evidence actually shows here as well. CoQ10 exists in two main forms. Ubiquinone is the oxidized form. This is the standard version that is found in most supplements. Ubiquinol is the reduced form, the active antioxidant version that the body predominantly uses. When you're taking ubiquinone orally, the body converts a meaningful portion of that into ubiquinol after it absorbs it. That conversion is a normal part of the processing that takes place in our bodies. A randomized crossover trial in healthy adults found that CoQ10 appears in the blood predominantly as ubiquinol, regardless of which form is taken orally. The same trial found that a water-soluble form of CoQ10 showed significantly higher bioavailability than the standard ubiquinone capsules. It was about 2.4 times higher in bioavailability. What this tells me clinically is that the form conversation when it comes to CoQ10 is real, but it's also not the whole story. Formulation and delivery matter. How a supplement is packaged, whether it's with a fat-soluble carrier, whether it's taken with food, or whether the delivery vehicle itself supports absorption, may matter just as much as which form is used on the label. So the point that I want to make here is that a supplement can be the right molecule and still be poorly absorbed, which means that the person can be taking something that is legitimate and still not be getting meaningful delivery to the cells and to the tissues. This is another layer of the gap that occurs, especially when there are hidden gut health situations going on. Drop it in the comments below. I read everyone because these patterns here are very informative, and I'd love to start a conversation around form and delivery. So what does this mean practically? And what shifts when you look at CoQ10 supplementation through this depletion demand gap lens? The first question is to look at what's actively draining the system. That means going through your medication list, not just statins, but all of them, and mapping which one is documented to deplete CoQ10 over time. And it means looking at dietary patterns as well, not just for macros, but your minerals, your micronutrients, the B vitamin density. It also means asking whether or not chronic stress chemistry, whether you perceive it or not, is increasing your demand faster than your current inputs are meeting. The second question is whether or not your system has the foundational capacity to use what it's being given. CoQ10 requires active B vitamins to be synthesized, and it also requires magnesium as a cofactor that needs to be present for this reaction to even take place. So if magnesium is depleted from diuretic use or chronic stress or a low mineral diet, CoQ10 supplementation is trying to run in a system that's missing most of its supporting cast members. This is why the standard advice, just take more CoQ10, so often produces the response that I hear in practice. They may be supplementing for months consistently, and yet there's no meaningful change in energy capacity or resilience that is both perceived and exertional. From a systems-based functional medicine perspective, this is a sequencing problem as much as it is a nutrient depletion problem. The gap has to be identified before it can be closed. And closing it usually means working both sides of this equation, reducing what's draining and building the foundational capacity to absorb and to use what's being added. And this is where advanced functional lab testing can give us deeper insight into what's going on at this functional nutrient level, far beyond what normal blood labs can show us. And if you've reached a threshold where your supplementation plan isn't moving the needle and you're in one of the states that I practice, the next step is to watch the free training in the description below. It prepares you to book a health mystery map call with me. And it gives you a clearer picture of whether what I do fits where you are. Here's the next question I want you, as you're watching this, to carry forward with you. Before you add the next thing to your supplement stack, can you name what's actively depleting faster than you're replacing? Because if you can't answer that, you're optimizing just one side of a two-sided equation. And the next question, one that I see misunderstood just as often, is what happens when you address the depletion side and the foundation is in place, but the mitochondria themselves are still underperforming? Because there's a layer underneath nutrient status that has to do with how mitochondria read the environment and whether they shift into a defensive posture that changes the game entirely in mitochondrial and heart health. That's what this video here goes through. What it means when your mitochondria are in defense mode and why that state can persist even when your labs and your nutrient status are dialed in. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.